Yeah.
Now, how does this work?
Ask a guess.
Ask a guess? What?
No.
Oh, thank you.
My question.
Oh, it works. Thank you, Arthur. Oh my God, I need my son to help me with Instagram. Hey guys, this is how it works. This is so cool. Oh my God, I never expect the world at 1 o'clock on a weekday. Hi, this is Dr. Janelle Luke. I guess I have to repeat a little bit as people are joining in. This is our Heart to Heart Luke series in the heat of COVID-19 pandemic, talking about sex and time intercourse. And during the COVID-19 and what are the guidelines, and nice to see you all too. Very exciting times during our 2020. I was just talking to family and friends. This is like our never have happened before. This is history. People should write a diary and to discuss this. Any case, I'm so happy to see you all. I guess we're getting more people. I can't wait. I want to make this a little bit more exciting and not like dry. So yeah, you can see my little shirt here. I have a little I don't know, my mother-in-law gave me as a gift, so I thought it would be less boring for the talk and so forth. So yes, love you all. I got lots of hearts. That's so cute. Okay, now I am going to talk a little bit on oh, you like this shirt? I got it finally. Oh, it took me a while. Sorry. Again, Instagram new to Instagram. To make it so when I talk to patient before all this COVID-19, our staff learning to when they talk to patient, it's like, hey, Miss So and So, you need to have sex. Not sex. They don't usually say time intercourse. Dr. Luke would like you to have time intercourse on March 14, March 15, March 16th. And then one of my patients gave me a feedback was like, Dr. Luke, it really turned off my libido the whole day. So I always try to tell my patient that maybe you're having sex. So I say it in a, I guess, not professional ways to make it less like dry, like having time intercourse should be great. Oh, hi guys. Hi everyone. I know everyone's keep on joining. So I am going to talk a little bit about, I make some notes. I know more notes than even the other talk the other day about COVID-19. What do we do in terms of as a couple? Should we get pregnant? Should we not? But beyond that, just sex itself, should you even have sex during COVID-19? Now, interestingly, I've been searching all the press release from the White House or any CDC. No one really talking about sex. No one really talking about, I guess, sex as in the format of like protected or not protected, birth control, no birth control. No one really talking about it. So I found it really interesting. So I kind of talked to do some research on transmission rate with sex intercourse. And again, it's new. I mean, we're right now during the pandemic, no one is doing, not many research. It's not like years of research have been done on COVID-19 and sexual transmission. So we don't know. But by common sense, when you have sex, you're in close proximity with each other. So if your partner has it, you can have it. But another very interesting fact, and this is I think more recorded in China as well, is what is the household transmission. So what if your husband have it? What is the chances that you can also have COVID-19? The percentage is actually about 3 to 10%. Interesting. So it's not 100%. I thought it would be 100. So if my partner, I have to have it, but it's actually not. So I know some of your family members may have had it. You're wondering if you have it. It's not 100%, but obviously the guideline is quarantine. Don't go out and say you don't have it if you don't have the test. How would you know you have it or not have it? So you kind of assume you're exposed to COVID-19 and you want to quarantine yourself for 14 days. And that is what properly should be done. In any case, ASRM guidelines, I talk about it a lot. I know it's boring. ASRM guidelines do not recommend patients to try to get pregnant actively. Currently, right now, it can be, because what happened, you have miscarriages or something happened, then if the OR, the hospital is still overwhelmed with crowds, it is very difficult to get into emergency room. And so that's the recommendation. I try not to get pregnant during pandemic. But at the same time, lots of my patients who have been having issues or, a little bit older, they like, Dr. Luke, how are you going to ask me to wait for a year to get pregnant? So those are all very reasonable talks and conversations with your doctors, with your partner, with yourself, what is reasonable and what's not reasonable. And so it is also very important to understand that. Oh, some people ask questions already. Yes, my office is open for essential visits. Treatments are really determined case by case basis. But for example, last couple of days, I've seen patients who had bleeding during pregnancy, may not be a miscarriage, or we don't want to send them to emergency room. They don't have yet. They're OBGYN, and some OBGYN practice are half open. So those are the visits we are seeing right now. What can we do while we wait? Well, before we talk about that, there's no direct answer to that. Because everyone is different circumstances. Some people are still working and they worry they can expose to COVID, and they don't want their personnel to expose COVID. So they or the family member exposed COVID, so they maybe not wanting to have sex. So while we're waiting, there are lots of different questions that I'm sorry, I'm going to provide you more information before we go to the answer to because at the end, the answer is really between yourself, your partner, and in some ways, the doctor. But it's not having sex. You don't really need my permission or non-permission, because I've been telling patients a couple of times not to have sex. They don't listen to me. They have sex. So sex, I think, is a very personal decision. In any case, some studies was done because this is very stressful. When there's so much stress, do people even have sex? Is it a need or a want? So I have some data here on one of the interesting, is in the Wenqian earthquake back in 2008. So they did some research in China and on married women who and asking them such a stressful times, do you want to have sex? And the basically majority of the married women said no, they don't. The sexual activity decreased tremendously. So before the earthquake, 67% of the married women reported they were having sex 2 or more times a week. 1 week after the earthquake, that number fell to 4%. And by 4 weeks, only 24% reported they were having sex 2 or more times a week. So that's one of the data that was in New York Times and talking about it. Interesting. And then people also asked in the retrospective data, women were asked to recall their sexual activity 8 weeks after the earthquake. And but as you can see, an earthquake is not the same as a pandemic. And then it seems like unlikely the activity even increase, even 4 to 8 weeks afterwards. So there's no in terms, I know some people are starting to ask me other very interesting questions, ask me about embryo transfers and so forth, and vitamins, which I'm going to write down to get there so I don't disturb my thoughts. As some of you know, Dr. Luke has lots of ideas, and sometimes I may forget to answer and get back to you, or I'm talking now lots of chain of thoughts, so I don't want to be too disorganized, so I'm writing everything. Save time for transfers, we can talk about that. Hi all, how are you? Very nice seeing you all. Very exciting in a rainy, but some of you may be in Miami, so maybe nicer. But right now it's very rainy and cold. Not nice. Yes, so it's time intercourse and sex while we wait. I was just talking to a patient about sex, intercourse, and timing. If there was no COVID-19, yes, Dr. Luke talked about please get pregnant the natural way love for you to get pregnant the natural way. But when you are not, you know, right now with the COVID-19, that really a judgment call with sex. But again, ASRM guidelines say don't get pregnant during the pandemic. That's why Dr. Luke has canceled so many transfers, so many cycles, so many IUI, and also Dr. Najat too at my office. But we are also understanding everyone has different priorities and everyone have different, feelings to come out of the house or go to see me. So everyone has different risk and benefit ratio. So, but at the same time, majority of us right now at home. That's why Dr. Luke is doing Instagram at 1 p.m. on a Thursday. Most of the time on Thursday, Dr. Luke either is doing a surgery at home and you guys will be working. No one will be watching my Instagram. Maybe I'll only get one person, not like all of you to come and see us. So, and I would say that it is a, looking at the streets, I want to tell you a personal feeling. I know people are starting to feel better because of the numbers of admission to hospital, maybe less or intensive care unit. But I was just telling to my staff right now, I'm not encouraging anyone to walk out. I'm just saying after 10 or 14 days, I feel a little bit better than when I was at the beginning of March, when I knew the virus was, new as in looking at data and understanding the world. Virus was in New York, but there was no testing. That was scary. That means people were still having, walking, working, going to the parks. My children were still at school. That was to me the scariest time. So in terms of anxiety wise, I want all of you to be feeling a little bit better. This is better. Like we know we are safe. I bet all of you have been locked in your house for 2 and 3 weeks. So yay, you're safe and hopefully your family members are safe and your good ones are safe, loved ones, and it's important. So I talk about transmission, and I do not know COVID transmission in terms of sexually transmitted. How does it play with sex? It's a bit different from gonorrhea. It's different from chlamydia. So we cannot look at COVID-19 in that way. So that's why I was insinuating, and sorry, I know some people just joined, so I want to get back to what I just talked about, is the people who just joined, is to say that I'm using household transmission. Basically, if your partner have it, just forget about even sex. You're eating the same table, you may use the same bathroom. What is the transmission rate? According to WHO, is about 3 to 10%. So it's not 100%. At the beginning, I thought it was 100%. But in terms of sex, we don't know. But I'm just using a close proximity thinking for you to understand what that, why it will be using that percentage for sex transmission. But again, sex transmissions is unknown. I know someone emailed me a question about sex toys. So I thought it was interesting. I don't know if people are using that or utilizing that. Basically, the method of if you have been using them alone, you should be fine. But however, if you're sharing your toys within the past 72 hours, make sure they are appropriately clean and wash your hands afterwards, as the virus may stay active on a surface for up to 3 days. So this is kind of everything we are talking about, sensitizing, wiping surfaces, because the virus can survive for 3 days, right? So that's why you clean your hands, you clean the handle, iPhones. We talked about that yesterday. And some of you are asking me about the ultraviolet box that I put my iPhone in once a day or twice a day. I have to get the brand for you. I think it's sold out already. Just some of you will emailing me, asking me afterwards. I don't know if you can still order it, but I will try to find out, and then maybe you guys be more creative and find ways to order that. And some very interesting questions that came to me later in the day when we told patient we're going to do this is, what is the safe sex look like in the future? This is a very interesting question. Hopefully COVID-19 will disappear one day. But if there is COVID-19 in the future, then COVID-19 can be in some ways, when you're close proximity, kissing, droplets, breathing, you can still transmit to your partner. So hopefully, with all our quarantine and social distancing, this will disappear. Okay, so now some of you email me and say, Dr. I can't wait. Yeah, UV phone box. Great. Yep, someone responded that. And asked me about what if you guys do want to have sex, what should we do, and so forth. So right now, some of my patients, if you are able to cycle, means you don't need medications, you can cycle spontaneously. I usually ask them to time your own cycles at home. If you still want to have sex, you don't need me. You don't need to come in and time your blood work and look at your follicles. So I have them just use a ovulation kit. If they insist on, again, having sex, where ASRM guidelines discourage people from trying to get pregnant as of right now. But the curve of LH is very fascinating. I want to talk about science. It may be a little bit boring now, not really fun in terms of sex, but this really talk about timing of time intercourse. First of all, sperm survive about 72 hours in the vagina. Very good, interesting, right? So sperm, you don't have sex, and the sperm swam up to the egg at that moment. Conception isn't right then. So if you have sex at 10:40 p.m., you don't have a baby or conceived at 11 p.m. Okay? So some very interesting fact you should know. So sometimes the sperm may have swum up there tomorrow at 11 a.m. And so some interesting facts. Egg usually survives shorter, only 24 hours. So you don't really need to have sex right when your egg comes out. You can have sex 24 hours later or 24 hours earlier. Also interesting. And also for people to avoid getting pregnant, this is also information to know. Some people think, I'm ovulating 2 days from now. It's safe to have sex. I'm never going to get pregnant. No, actually you can, because sperm, I just told you, survive about 48 to 72 hours. So if you try to avoid getting pregnant, please do not have sex right around your ovulation time. So it's very important. Now, how do we calculate ovulation time? Now, all this are estimate, because if you don't come to the office, which again, we don't encourage anyone who is having time intercourse to keep on repetitively come to office because we're under quarantine right now, is how to time it. If your cycle is around 28 days or 26 days, let's talk about the two. 26 days is a short cycle. 28 days is what average cycles are. Now, 28 days cycle, let's say you're 25 days. Oh my God, I'm abnormal, Dr. Luke. It's not you're abnormal. You do have a shorter cycles, but you may also ovulate a little bit earlier. So I usually divide it by 2. This is not hardcore science. This is not like, I'm going to ovulate exactly what Dr. Luke said, day 14, if I have a menstrual cycle of 28 days. So it does come into a little bit like your lifestyle, your timing, stress, many things. So it doesn't always happen that way, but it's just a very crude calculation. So you kind of understand when to have sex. So the sex time is around, let's say you do 28 days and your day 14 is the day you're going to ovulate, then you will have around start time intercourse will be day 12, day 14, day 16. Same thing with avoiding to have sex. You don't want to get pregnant. You start to avoid like 2 to 3 days before your ovulation day. Okay? 2 to 3 after your ovulation day. So if you time yourself quickly, then you will try to not to get pregnant during those times. The LH kit is a very interesting thing they're using at home, and I drew this today. And basically, the LH is what the hormone making you ovulate. It's a kick, like you kick a ball. And the LH basically rise within that very kind of kick. That's how it goes. Every moment in the middle of the month. If you're a 26-day cycle, this may happen on day 12. If you're a 28-day cycle, this may happen on day 13 to day 14. So this is the kick that is happening. The ovulation kit that you're doing is really only sends the curve up here. Okay? Interesting. The point is, I'm using my kids kind of kids' color pencil to guide it. Next time, I think we have to do zoom in for me to do a presentation. But some of my patients said it's so boring, so I'm using papers, and hopefully this works, okay? And you understand. So this is a curve from the rise of the surge to ovulation date, and this is the curve from coming down to ovulation day, and I should put 12 to 24 hours. Okay, so so basically it's this whole thing before and after is where you can really timing it. So why I drew all this craziness? The LH kit that you're using at home only sends the high peak right here, okay? It doesn't sense LH down here or down here. So what does that mean? You don't know your curve when your LH kit is positive or your timing for conception. Again, this can be for birth control purposes if you're trying to avoid having sex or trying to get pregnant. You don't know your curve is up when you're positive at home. You don't know you're here or you're here because the kit will still blink, blink. You don't know where you are. And I know some of the ovulation kit are better. They can go from slowly, like if you test the kit, it will go from here all the way up here. Like it will sense the LH pulsatile motions from before you get up here. So any case, once you get in here, then the issue here is how good is your LH kit and where are you ovulating. So if you're down here, you're very close. About 12 to 24 hours will be the ovulation. If you're here, you're still about 36 hours from ovulation. Okay? So the kit is not as precise, obviously, at my blood work at my office, but at the same time, this is one of the best things we can do right now when you're at home. Okay? Either avoiding getting pregnant or trying to get pregnant. You have to understand this curve in a better way. Okay? So, but understand that this is where and I have patients who are doing natural cycles, who doesn't like shots. They really make me do this curve with them to get the egg out. Because now Dr. Luke is trying to do an egg retrieval, and I have to know when is the egg coming out, which is a lot harder than sex. Because one more time, sex 72 hours is when the sperm will survive, and the egg survive about 24 hours. So you don't really need to have sex on the moment your egg comes out. But when Dr. Luke trying to get an egg, I need to know when the moment the egg come out. So I got some more questions, and then I think it's good for the day because I know lots of TED Talks, 18 minutes. So why is it 18 minutes? Because our attention span usually is 18 minutes, and you guys are busy doing many things at home. So I always understand. Oh, where's my questions? I wrote down. Okay. Yes, 2 questions. One is prenatal vitamins. What kind of prenatal vitamins we are taking? I never like patients doing too much prenatal, like spend money on prenatals. It is good to have some folate. I mean, any prenatals usually work. To share something personal, I never took prenatal vitamins during my pregnancy. I was very nauseous. I nearly really sick. If I don't work, I'm bedridden. I only use work to erase all my bad memories during the 9 months carrying the baby. So I usually, any vitamins, eat a healthy diet. Most of our American diet is fortified with lots of vitamins. Even folate is in spaghetti. Or iodine. It's in spaghetti. I don't know folate. Sorry, I may have said something wrong. So, but please take a look at your diet. But any prenatal vitamins will be fine. In terms of COVID-19, is there any vitamins? There's some data on vitamin C. And this is coming from another sources, other doctors who are right now treating COVID patients. Vitamin C, orange, and not any antioxidant. Don't overdose yourself, but vitamin C, they were doing that in some part of hospitals in China, I heard, and especially in some of the pandemic areas in New York City and the hospitals, they will giving patients vitamin C, like COVID patients. Second, but in terms of prenatals, any prenatals were fine. Try not to waste money on that. What do you recommend for egg quality? Egg quality is tough. Egg quality, I usually select certain I love berries. I love antioxidant. Is again, as you know, some of the things that I want to teach you or you guys want to learn more has no objective data. Means it's not black, it's not white. Means if there's 10 doctors saying the same thing, you may not get 10 doctors saying the same thing. That's black and white. Let's say COVID-19, everyone should be at the house. All the doctors will tell you that everyone should stay in the house. That's black and white. There's no gray, right? So same thing with equality and vitamins. It's kind of gray. It works for some patients. It doesn't work for some patients. So usually I love acai berry. I love like antioxidants. And those are very good, I think, diet. For equality. Try to eat less like kind of fried food. I really think that many data has comes in lots of organic compounds that is produced by frying that can also causes that. So just avoid that. And I mean, I know CNN, I don't know, I saw some, I should not say CNN, but any news agency, they post some immune diet for COVID. I don't know who approved that, but I was looking at it, I was like, oh, they have kale, they have vegetables, they have berries. That sounds good. I mean, at the end, it's all about vegetables and antioxidants because interestingly, ovary, when they die, is a process of apoptosis or atresia, means they die with oxidative stress. So oxidative stress, antioxidant, hopefully will help with that. But there's no, again, black and white data to prove exactly about that. But common sense wise, why not? Eat healthy, antioxidant would be great. Yes, some people and why it's not best to get pregnant right now. Of course, there's too much unknown. And also common sense. I mean, right now there's a pandemic out there. I think it would get better. I may change in about 1 month. We can have another sex talk in about 1 month. But I think it will change. But right now, yes, the guidelines say no to try to get pregnant, especially when you have to go to a fertility's office. And then gluten. I got some question about gluten. The gluten fertility is funny. Actually, when I was in training at Yale Fellowship, I was one of my attending is very into celiac disease, which is allergy to gluten. I didn't know what is a gluten-free diet. I love bread. I love things with gluten in it. And so, but then there was some data, which is a little bit old data on gluten diet and miscarriages. Now, some of my patients who I transferred the most perfect embryo, something happened or it didn't work, once or twice, I do start to ask them to say, hey guys, can we cut down gluten, change your diet, let's see what else we can do to help you to get pregnant with your next embryo transfer or your pregnancy or they have miscarriage. So in the past, I have the standard of care when I was in training, they do check celiac disease and immunity to gluten, which is celiac disease, gluten, immunology. But now, many data had dispute that, so we don't do that anymore. But if gluten does not mean too much to you, and you have failed, or have miscarriages or anything, then may not be a bad idea. But okay, let's see. Okay, right. And not getting pregnant now is, I think, is more common sense to national guidelines and people who are our leaders or governing bodies. One more time, if you do get pregnant and let's say you have miscarriage and you're bleeding, it's good that if you are my patient, you're able to come to my office and you don't go to emergency room. But if you end up in the emergency room or something bad happened, right now hospitals are overloaded. They don't want any unnecessary visits. So I think from a CDC guidelines, from a ASRM, from that point of view, that's important. Second, yes, COVID-19, we don't know how it affect the mommy or the baby. I did talk to some of my OBGYN friends. These are all limited data. They have patients who did have COVID, got very sick, but baby is fine so far. It hasn't delivered yet. So pregnant women's in, I think lots of American College OBGYN data and also data from China will give us a lot more insight on COVID-19 and how it will affect the pregnancy. But I only have one patient. Sadly, I did have one patient who was who had COVID. She was already 8 weeks or 9 weeks pregnant, but knock on wood, she called me. Everything is fine. She worked in the hospital, so she called it after she graduated from me. But she seems okay, and hopefully the baby will be fine. And with and hopefully many babies will be fine. And so far, it seems pretty good. Sorry, guys, I'm just kind of looking if there's any question. There's no the safe time projection. I think my projection will be June. I think May people start to come out and start maybe doing treatment or cycles. June, I think maybe that's my intuition. I think May is a little bit too soon. That's my feelings, but it can be wrong. So, and guys, one more time, I said that in my last, and maybe this will be my ending comment before we end today. This is right now, the streets are empty, no one at the park. In 2-3 weeks, it's going to get warm. People are going to be excited. Yay, I'm coming out. And I will get phone calls. You guys may say, Dr. Luke, we're going to do transfers. Yay, it's great now. My worry is what will happen in 2 to 3 weeks. So try not to let your guard down. Like right now, the street, I think, is cleaner than anyone else. I mean, there's no people in the street. It's 14 days empty. But my worry is what will happen when we all are very happy, when all our news media say, oh, numbers are down, we are doing well, we are all can't wait. Our body wants to go out. Everyone wants to go out. And that is where I think my most worry. So with that note, I would say practice safe sex, practice social distancing. I can't wait to talk to you again next week. Next week is fascinating. I'm going to do a little bit more talk on like things I may not have time to talk about or never film about. ICSI was ICSI. What is PGTA, like a little bit more about IVF, like a little bit more about fertility, intensive kind of a course. So then during patients who are preparing for fertility treatment or people who are thinking about IVF will get a little bit more insight. So can't wait to talk to you guys next week. I may have even some guests in the coming weeks ahead. So I will share my time with you again. And we're trying to do it on Tuesday and Thursday at 1 p.m. Because that's the days that our office is closed the whole day. And I will come back home and stay at home and talk to you and share some of our knowledge and wisdom and share some of your questions. Okay, guys, I will talk to you later and stay safe. Bye-bye. And